wake up to the same old fight, chasing shadows in the night. Promises made, but I let them fade. Caught in the cycle, I'm feeling betrayed. Round and round, I'm losing ground. Trying to break free, but I can't see. These negative patterns are haunting me. Nights turn to days, I'm losing my way. Thought I found peace, but it's led me astray. Chasing the high, but it only brings pain. The more I run, the less I gain.
Hey everybody, hey! You are in the office for another session of Tarka Say It Again. Yes, hashtag addictive patterns. Now, we have a special guest in the office with us today, Dr. Andrea Dunn. You heard Doctor on the front end of that. And she's going to give you her background. She's going to tell you what she's a doctor of. But first, let's go ahead and want to give you some background information on today's session. Today, we will be talking about HIV and AIDS. Now, that's something we know was a pandemic that came about many moons ago. And it seemed like it just disappeared, subsided, right? But it seems like it's back now, right? We've been seeing videos, putting people on blast. Like, that's a whole different story within themselves of people being aware of having it and not sharing that information. But we're going to get into all of that. But we want to back up and just give you a definition. When we talk about HIV, we know that is a human immunodeficiency. Did I say that correct?
Yes.
Okay. Right? It's a virus that deals with those cells, typically those cells that fight diseases, right?
Our white blood cells.
Okay, the white blood cells, all right. And so then we have AIDS, which is a acquired human or
immunodeficiency.
Okay, an acquired immunodeficiency syndrome. So there is a difference, and we know that one is a little bit more severe. And I've heard, like, if it's under a certain numbers, those, I guess, the cell numbers drop. That's what puts you in the category of having full-blown AIDS, you would say. Okay.
AIDS.
Yeah. AIDS. Okay. And listen, I'm saying it like this because I want to make sure I'm saying it right. Because we know that there are definitely a lot of myths out there, and we want to get some truths, exchange some of these myths for some of these truths. And I'm going to turn it over to her so she can, educate us.
Yeah, so I am Dr. Andrea Dunn, founder and executive director of Let's Beehive, which is my nonprofit organization that I founded back in June of 2015, so almost 10 years
It's
now.
been a long time, because I remember when you first had your pop-out, you know what I mean? When you introduced it to the world, and it's still going.
Yes, oh my gosh, that was our first community outreach event was June. Yep, that same month that we got incorporated, we started community outreach, and then our first big event was the very first Queen Bee, which was March of 2016.
I love it.
It's been going strong ever since then. But yeah, so there is a difference between HIV and AIDS. And so I was really happy to hear you share the difference. But usually with the cell count that you mentioned as far as a number, usually the diagnosis takes place when they take the very first viral load and the very first CD4 count, which is a part of our white blood cells.
Okay.
And so depending upon what those numbers are will dictate if you get diagnosed with HIV or AIDS. So usually that number is less than 200. And that means 200 copies of HIV within your blood sample that they take. So if it's less than 200 copies, then that means you don't hardly have any white blood cells.
Okay.
Right? So then that means that HIV is kind of overtaking your immune system. And then if you have greater than 200 copies, the more white blood cells you have, the better your immune system will fight.
Okay.
So, yeah, there's a big difference. And we usually I'll let you know too, we usually don't say full blown in the HIV community because individuals who are living with HIV can feel stigmatized.
Okay.
You say full blown, but it's just a level of numbers within their bodies.
Mhm.
But I think a lot of times people say that it's just because the virus is like taken over
Mhm.
at that time, and it's multiplying very, very rapidly.
Mhm. And
at
I'm
that
glad
point.
you bringing that out because that was what we heard growing
Yeah.
up.
Yeah.
You know, he or she has full-blown AIDS, you know,
Mhm.
not knowing that that could stigmatize a person. And I'm sure we all can relate to that with different conditions and illnesses that people have, where it's certain words that you use, it could be insensitive to them.
Mhm.
So I get it.
Yeah. But that's just something, you know, as far as patterns and things
Okay.
that we've learned,
Yes.
that it just seems to kind of stay with us, not realizing those things. But I'll definitely give you those little tidbits.
Okay, yeah, I appreciate it.
Keep chatting. But I love what I do in the community. I really started Let's Beehive just based on the things that I was seeing
Mhm.
in the community and seeing that people didn't have as much education about HIV. And to be honest with you, it's never gone anywhere.
Mhm.
I feel like it just left maybe media and mainstream to where people in the community probably think, oh, it went away, but it never did.
Right, right.
And specifically here in Orlando, with Trump's administration and everything prior, when he was in office before, he started the end of the HIV epidemic, right?
Mm.
So there's certain jurisdictions within the United States that are high priorities.
Wow.
And a lot of people don't realize it, but Orlando, Orange County metropolitan area is one of those top jurisdictions that they're focusing on because the rates of HIV is spreading so much faster in our community that there's a priority here.
Now that's something because obviously you looking at numbers and stats, right?
Mhm.
And here we've heard less about it here lately.
Yeah.
But now it's like coming back around. Like you said, it hasn't gone nowhere.
Yeah.
But the fact, I guess you would say, like distractions
Mhm.
to where it wasn't at the forefront.
Mhm.
Wow. And we're top.
Yeah. So we're in the top 10 when you look at cities or metropolitan areas that are the most affected by new HIV diagnoses, right? So within the United States, we were previously ranked number 3 in the top 10. Now we're down to, we were at 5 and now we're at 6.
Okay.
So we're coming down,
but that's
we're still
top
in the top
10.
10. And it's been literally like that the entire 10 years that we've been doing outreach. We've always been in the top 10 for new diagnoses. So it's spreading pretty rapidly in our community. And I don't know if people realize that's why we're trying to do so much with education and empowering people to get tested and know their status, get on treatment, and just be able to incorporate that in their everyday lifestyle or every annual testing or just as far as their sexual health and prioritizing that.
Okay. So I did hear you mention patterns, right? And you know my book, Addictive Patterns.
Yes, ma'am.
Right? And we know with addictive patterns, I always say that it's either hereditary or it's learned behavior or generational curses. So in hearing the 3 of those and dealing with this illness or this condition, which one would you categorize out of the 3? Which would you say?
With HIV? Definitely learned behaviors.
Whoa.
Yeah.
Learned behaviors.
There's a lot of things that I believe are societal norms, right? That we just feel like, oh, this is what we're supposed to do because this is what we learned. Or in social media, you see such like this sex craze, and even with just drinking or drugs or just socializing and having fun. You see all these things, but I feel like a lot of those things are ways that we've just learned, and they're learned patterns that can kind of put us more vulnerable to HIV transmission unknowingly. Right. And I think that's why with the numbers and the rates that we see is mainly affecting the Black communities of color.
Well, hey, you all have heard it. She said learn behavior. And are you able to like touch on some of those? Because that makes me think about the myths, right?
Yes.
And I want to make sure that we got that correct because like growing up, people would be afraid to touch or hug somebody when they knew that the person had this illness.
Yeah.
So what would you say to hugging? What would you say to kissing?
And honestly, I feel like, think about it when we had COVID, for example, and nobody didn't know how it was spread, how it was going around, how it would affect your body. And I was born in the 80s, but I don't know what was going on in the 80s when it first happened, when HIV first kind of came on the scene. And it wasn't even called that back then. But even then, they didn't know, is it okay to touch? And you think of Magic Johnson, for example, and him playing sports, and they didn't know how it was transmitted at the time, so he had to step down. But I would really like everybody to know, and I always do this with outreach as well, with education, it's not spread through hugging, toilets, using, public restrooms. The bodily fluids that are main concerns are blood. That's the number one way. So if there's any sharing of blood, right?
Blood transfusions.
In the past, yes, people were newly diagnosed because they had blood transfusions. So now we don't have to worry about that because they screen all the bloods before. Is there still a risk? Possibly, yes. But it's minimized drastically now compared to what it was back in the 80s. But sharing blood, vaginal or semen fluids, sharing during sexual intercourse, and then breast milk is another bodily fluid. So even mothers who are living with HIV are, and that's even changed recently with the guidelines, but before, women who were living with HIV weren't allowed to breastfeed. So in third world countries, that's why a lot of, like in Africa, a lot of mothers are still breastfeeding their babies, but because they have no other forms of nourishment to be able to give their kids. And that's how a lot of transmission was taking place, through breast milk and breastfeeding, but not urine, not saliva. It takes, and some people even ask the question, oh, can you get HIV from kissing?
Right, that was something that was out there. Yeah.
No, not unless you have a cut or your gums are open and there's some blood shared that way, right? But from kissing alone, just kissing, no. Pet kissing, saliva, tongue kissing, none of that. Those things are big myths, I think, within the community. So we don't have to be afraid of individuals who are living with HIV, even just in the same room, breathing the same air, hugging, anything, kissing, none of that. If you're not sexually active with them or sharing needles through intravenous drug use or any type of needle that you're sharing with them, there's no way of transmitting. And then another thing to think about as well for people who are living, and one thing that I love the most with pharmacy is the power of the treatments. And the medications are working so well now. We've advanced so much that it's prolonging their lives. And so treatment and having undetectable or like low viral levels in the body, then there's no way that they could transmit, even sexually or sharing drugs, sharing needles with someone, that they would not be able to transmit HIV, mainly sexually. But if they're on treatment, in care, taking care of themselves, it even lowers the risk of transmission. So I always, with our initiatives and things that we do for women, I always think of like Cookie Johnson, right? People don't really talk about her as much, but she's been with Magic. She stated she's not living with HIV, but that's because he's in care. His treatment is managing his HIV, and it's so low, there's no way that he could transmit it. And so that's changed. And I think as far as myths, people just thinking it's only for the gay populations, right?
That was another one as well. Yes.
Men, women feel like only men transmit it to women, and that's not necessarily the case. Women can transmit to men, or even just thinking that, oh, it's not going to happen, or things like that. There's a lot of myths that you can't see this disease.
Right. You
can't see it. So you can't look at somebody and necessarily tell. And those are the things that I feel like we really try to help people in the community understand.
So almost like a biological warfare that's going on. Like you say, you can't see it. It's biological. Gotcha.
Yeah.
So you talked about the myths, right, and some truths. What would you say, because you work with patients on a day-to-day basis? So can you give us some information of what that looks like as far as symptoms? Like, how would a person know? Does it have to be something that's just devastating, or is there just some symptoms that they would look for?
Yeah, I think this is a great question. It depends on the stage
Okay.
of HIV, what the symptoms would look like.
Okay.
In the very beginning, if someone, maybe was just recently exposed, right? Say maybe 3 days ago they had sexual intercourse, was exposed unknowingly, and their body is going to start going through a process that they call seroconversion.
Seroconversion. Okay.
Converting from negative status to developing antibodies to fight HIV, and then HIV will eventually take over.
And that's where you become positive.
System, and that's when you convert from negative to positive.
Okay.
So in the very beginning, within probably the first 14 days, you might get cold-like symptoms, flu-like symptoms. So it's very hard for people to feel like, you might think you just have a cold. But over time, typically within the first, 2 weeks up to 30 days, 90 days, there's a window period where you can start to develop other symptoms. But some people's immune system is so well that it fights it. You think you might just have a cold and it goes away. So some people can be undiagnosed for up to 10 years.
Wow.
Without having drastic symptoms. It just depends on the level of their immune function and the integrity of their health. But then eventually they can get swollen lymph nodes, and that's usually, especially for men and women, there's different symptoms for women, like yeast infections, recurrent bacterial vaginosis of BV. Even having a prior STD could put you at a higher vulnerability to transmission of HIV. So, if you have any STIs in the genital areas and you're struggling in different areas, sometimes STDs kind of hang out together in groups. But for the most part, the symptoms would be fever, cough, swollen lymph nodes, and you can have them here under your arms or even in your growing area. Okay. Very large lumps, and you're not sure, oh my gosh, what is this? But the lymph system within our body is a part of our immune system. So it's a part of your immune system trying to fight this infection. Right. And sometimes it can, lie dormant in other areas of our body. But definitely, once you progress to no treatment, you don't know you may have it. And there's, I think of one young lady on social media, Gina 2. I don't know if you've heard of her. But she shared her story because she was newly diagnosed, but she was in AIDS at diagnosis. And she had drastic weight loss. And then oftentimes you can get forms of pneumonia, because your immune system has no ability to fight over a longer period of time. So you start to develop different infections that either they're skin infections, skin lesions. There's certain things that, we'll see in addition to having labs that match some of these symptoms that will probably lead a physician to order a test on you. But sometimes you can have organ failure, so kidney failure. It can get really bad over time. Yes. HIV is an inflammatory disease. So it can affect the heart, our kidneys, more than anything, and the liver. So sometimes individuals may have swollen, enlarged belly sometimes, but it's their liver. Or they could have decreased urine output. Their kidneys can start failing. But HIV can affect various parts of our body. Some patients may even have seizures. Wow. It varies, but it takes time. But usually in the beginning, I would say swollen lymph nodes might be the first. Night sweats. Extreme, patients have described, I mean, waking up drenched, like the whole bed is wet. Not just like, oh, I'm hot and you sweating a little bit. No, like extreme night sweats, swollen lymph nodes, headache, vomiting, diarrhea, a lot of GI upset, which is very similar to flu. You know what I mean? You might feel like you have the flu and you're just not feeling well. But oftentimes, I would say within the first 90 days.
So basically, if you see it being consistent, you basically need to go to the doctor and get it checked out. Because that's what I'm hearing, you know, because some of the symptoms that you're sharing, like you say, it could be considered the flu. A person would think that. And even with the sweats, someone might think they're going through the changes, you know, like if they're of age, you know what I mean? So that could be confused. But you're saying if it's continuous, we just basically need to go to the doctor, make sure we're getting those checkups. OB/GYN, because they can do tests that your primary doctor can't do. So just making sure that we're
taking care of ourselves.
Checking up on ourselves physically.
Yeah.
And I also heard you mention the lady that with her diagnosis, or did you say unknowingly? I think you said undiagnosed. So in the reference that you made, because some people knowingly have it, and that's been a big ordeal as well, where you have people just knowingly and they still have unprotected sex. Like, what would you say to that, right? Because I feel like it's it's beyond a person. Like, that's, I don't even want to give it a bad word, but you get what I'm saying?
Some people are upset when they find out that they're diagnosed, and depending upon, and I'm not saying that that's right.
Right.
But when you're talking about the mental aspect of things, and they can feel like, well, I have it, so I'm going to give it to everybody I can because I have it. Right. And that's with malicious intent.
Right.
Not every person who is living with HIV or diagnosed with HIV has that desire. It's just people, for whatever reason, that may just feel that way. Or there's also stigma where people are afraid to share their diagnosis because they're afraid of the outcome and what can happen to them. But that's called disclosure.
Right.
So every state has different laws based on disclosure of HIV. And in the state of Florida, if someone, and I feel like we usually see this too on the news, and it's usually a black man plastered on social media.
Yes.
And it's, this man is knowingly, you know, spreading HIV, and then they're convicted. And they go to prison because in the state of Florida, it is against the law, and there are consequences to that. There's not many other diseases that you hear about other than HIV where it can come, but I think it's called criminalization of HIV if you knowingly spread. So that's why there's like a big difference of knowingly and unknowingly. But it does happen. It does happen. And I think, which to me adds on another layer of why we need to have preventative options available, because you may not know, and it's based on someone else either telling you or not. And so we have to figure out ways that we could protect ourselves, whether someone shares that with us or not, irrespective of our partners. But ideally, it's an obligation that eventually, if you start to get on a sexual level with someone, that you should disclose before. And I also recommend to patients and anyone who's probably listening that may be living with HIV or may want to disclose, don't know how, one of the good things that they can do to document and make sure that their partner is aware is to take them with you to the doctor.
Okay.
So that way it's documented in the chart, because usually the providers will document who is in attendance at that patient visit, if it's an outpatient visit. And then, because there's oftentimes where people will lie after and say, oh, well, you didn't tell me. And then they try to get them convicted if they were to become diagnosed with HIV, if they're with someone and say that person did disclose, but then now they're broken up, and people can be malicious in that way as well.
Mm-hmm, mm-hmm.
So in order to help individuals who are living with HIV, it's good for them to take their partners with them to the doctor.
Gotcha.
So it's known at an HIV visit, their partner was there and they're aware of their status. Some people even do contracts.
Okay.
To say that they disclose, because it's a way where I feel like you have, even people who are living with HIV have to protect themselves too, because people can lie and say, oh, they never disclosed to me. Whether they're positive or negative, people can still be reprimanded and criminalized for their disease and their diagnosis. So it's a thin line, you know, in the community to try to help people understand and help families understand, you know, the importance of disclosure. But people, if you are engaging in sexual activities, the person should know so they can have a choice to choose, you know, is this something that I want to do? Some people love each other through that.
Right.
So it's just a matter of giving the other person an option to choose whether or not they want to be with you or not, or still be friends with you, but maybe not on a sexual level or things of that sort, whatever may work between those two people. But it's important.
And I like how you pointed that out because, hey, I feel like going to the doctor or at least having that piece of paper to share that with your partner. Like, I've done it. You know what I mean? Especially like before getting married and different things like that. Yeah. Like,
or even dating.
Yes.
Get tested together.
Right. So I'm glad you pointed that out because I feel that's a practice that we, if we're not doing that, we should, you know, start exercising it.
It should become a new learned behavior.
A new learned behavior. I like that. Yes, ma'am.
A new learned behavior where testing with your partner becomes normal. I'm dating, right? Heterosexual Black woman living in a geographical area where the rates of HIV is high in the Black community. I like Black men. You know, it's high among Black men as well. So just naturally within our culture, within our community, it's just high. It doesn't necessarily mean, you know, you got to be sleeping with all these different people, being promiscuous. Those are myths.
Right.
That only individuals who have HIV or live in promiscuous lifestyles or off OBT, prostituting, things of that sort. And it's not like that at all. And I think that we have to overcome some of those learned behaviors big time in order to really help
educate
the community.
Exactly.
So we can truly end the HIV epidemic. It's a lot of barriers that I feel like we have to overcome in order to truly get to that understanding amongst one another. But it should be standard. And then I've had patients and some of my PrEP clients who have said, you know, well, my partner got upset when I brought up that I wanted us to get tested. Some people can't handle it. And to me, that might be a red flag.
Yeah.
Like, you might need to use condoms or do some other barrier protection until you feel comfortable enough to be with that individual. But if they get that upset, then, you know, this is a part of each other's sexual health. And if you can't have these conversations, then you probably shouldn't be doing that.
Or find another partner.
Yeah, or someone
that's intellectually on the same level as far as that, you know, as you are. That point blank period. Like you said, red flag. So you might want to pay attention to that. Yeah, that's something to think about.
Yeah.
Ooh. Listen, it's all about having these tough discussions, these tough conversations with your family members, your loved ones. Hey, just people in general, because you don't know, you know, if you don't share out, how will anyone know? So I feel we just need to continue to share. Hey, this is why I have her on here today. Just being serious, you know, this is a serious topic. And like she said, it hasn't gone anywhere. So, hey, felt the need to bring it up here on Tarka Say It Again. Hopefully you learned something from it. Is there anything else you want to share out with them? Because, listen, we covered a whole lot today.
We did. We did.
did.
The last thing I would say is I mentioned PrEP.
Okay.
And PrEP is a form of medication that can be used to prevent HIV. And a lot of people don't know about that either.
Okay.
So if you are HIV negative and say you're in a dating relationship with someone who may be positive, or you single and mingling and you doing your thing, maybe not use condoms that often, that PrEP is an option to help you stay negative. And so I would just recommend anybody, if you want to learn more about that, to definitely follow us at Let's Be Hive on Instagram. Our website is www.letsbehive.org, and that's B as in two E's, as the honeybee that I like to call everybody. But, you know, we're here as a resource to the community, help connect you. We get messages all the time, DMs, if people want to learn more, ask questions more, and be connected to resources. We can definitely help you with that.
All right. You heard it straight from Dr. Dunn herself. Thank you all for joining in for another session of Tarika Say It Again. Please check us out on YouTube or Spotify. Follow us on Instagram, Addictive Patterns, and check out our website, addictivepatterns.com. Y'all have a good one.